All right, welcome back. Dr. Barton here. So in this video, we're going to be talking about several concepts that I kind of mentioned in the first video. And the first thing is this concept that all of our spines need these 5 things to be healthy. And this is the same stuff that I go over with patients every single day in this room, in fact. And most people that have some type of back pain have one of these 5 things, if not multiple of them, wrong. And we're going to be looking at posture first, but just to kind of recap, we need good posture, we need good flexibility of our spine. It needs to be symmetrical, so if you're tighter on one side than the other side, it throws you off. We do need good strength of our spine, and youth is the one we can't control. And this one could also say genetics or history. They're the ones we can't control. I can't take away what happened to you. I can't take away your parents. You can't pick your parents. And the first thing I want to go over is posture. Now, we actually just did this because this is take 2, and we actually know what her result is going to be, but Amanda's going to help us with this. And the purpose of me showing you this is, if you want to check yourself at home, let's just say you have chronic neck pain, chronic shoulder pain, let's just say you can't even lift your shoulder up all the way, this is what you would do. And I call this the wall angel test. And what we're going to do is we're going to put the arms up in this position. This is the starting position, and she passes this part of the test, which is good. However, when we go all the way up, you will notice that her elbows come off of the wall. And you're supposed to be able to keep this all against the wall. And what it shows is that she has tight pecs. Her pecs are short, and they're creating tension that won't allow her to get her arms all the way back to the wall. Go ahead and hop off here. I'm going to show you what it's supposed to look like. And so we're here. And we're going to go all the way up, and we're just going to keep it against the wall. Now, all this says is that your pecs can retract the shoulders back to the right position to where you can stay against the wall. And what that says is that you don't have excess tension in your traps, which connect to your neck and your head. So if a person has chronic headaches, chronic neck pain, and they fail that test, you have work to do. In fact, there's a video on our website that illustrates what you need to be doing. And I will link to that so that you can reference that video if you need to. But this is something that's done at home. Of the 5 things that we need for our spine to be healthy, I really only usually control 2 of them, the flexibility and the symmetry. And then the patient, controls their posture. In other words, they work on that at home, and they also work on their strength. The reason strength is important for your spine is because your muscles stabilize the spine when you lift things. And the spine is a selectively flexible rod, meaning it's primarily stiff, but if you need it to be flexible, we can release that stiffness in certain ways and we gain flexibility. When you lift things, if the spine is not completely stiff during that entire lifting procedure, you can buckle parts of the spine, and you can injure the disc, you can tear a disc, and that's the path that people begin to go down when they injure their back for the first time. So strength of the spine is very important depending on the activity that you're doing, and there are different ways to assess that. We usually get into a plank position, and we'll hold a plank position for periods of time. So it's either going to be a front plank where the elbows are down, or it's going to be a side plank. And if you can't plank for like a minute at a time, in all those positions, you have some deficiency in the stabilizing muscles of your spine. That's how we determine that. That's not something we worry about a lot, because I worry a lot about the flexibility and the symmetry of a person's spine. And so when they come in, the vast majority of the time, a person will have an asymmetry or a stiffness in their spine that needs to be addressed, and there's different ways to address it. In fact, there are 5 things that can be asymmetrical in a person's low back or pelvis that creates the appearance of what we call a short leg. And we call that pelvic distortion. And you can have a tight hip flexor, a tight hamstring, tight fascia in the low back, tight joints in the low back, or an actual short leg, which only happens about 5% of the time, or probably even less than that. So most of the time, it's a combination of the other 4 things that create what we call pelvic distortion. Pelvic distortion is a basis for most people of low back pain. And if you don't go to doctors that can recognize that pelvic distortion and do things to mitigate it or make it better, you are basically kind of masking that back pain. You have to resolve the imbalance, the asymmetry, the lack of flexibility in certain tissues in order to make your back the way it was when it came from the factory, when you were brand new, before you injured it and went through what you've been through. So we're going to show how we assess for hip flexor, hamstring, and then the low back fascial flexibility. And we're going to use Amanda again for that. We're going to go face down here. So the first thing I do is I basically just pull the legs and I'm checking to see if they look even. And in her case, she is even. So I don't expect to see any particular asymmetry. I'm going to check the hip flexor first. The way we do this is we just kind of lift up and we're looking for full travel here. And then we're looking for symmetry. So if I go over here, I expect to feel similar to what I felt on the other side. And that's exactly what we have here. And that's really good. Let's go ahead and flip over on your back. Next, we'll check hamstrings. Very similar activity. If we pull the hamstring up here, we expect to see the same here as we do here. And that's largely the case. So in her case, she does not have a short leg, the appearance of a short leg. Remember, I can make one arm look short or the other by shifting my shoulders. And when a person comes in and they have a short leg, it's by the shifting of the hips that creates the appearance of a short leg. Most people do not have an actual short leg. Let's go ahead and sit up here. Let's come right over here. So the way that we assess for the fascia is we're basically going to kind of bend forward, and we can feel, if I take my thumb and kind of pick it, put it in a person's back and then bend forward, I can tell whether or not the fascia is tighter on one side than the other side. And if we release that through various techniques, we can balance it back out, and we can bring symmetry back into the spine or back into the pelvis. And another way that I do this when I check people out is we just kind of bend back into the side and then back into the other side, and I'm looking for symmetry. If you lean yourself back and you cannot lean back to one side as much as the other side, and it hurts more on one side, you have stiffness in your spine on that one side, and that's contributing to your back pain, no question about it. And there are ways to resolve that. You usually need professional help to do it, but the point is I wanted to show you that there's a method to doing it. There's a method to have visibility on asymmetry, okay? So I want to talk about this concept of the Ascension Model of treatment. I mentioned that in the first video. That just means you always do the simple stuff before you move on to the more complicated stuff. And when we're talking about disc disease, so disc herniation or tears of the disc or degenerative disc disease, most people try nothing at first, then they're going to move to possibly something like manipulation. What manipulation does with regard to disc disease or any kind of disc degeneration is it helps the spine to work better. If the spine works better, it's probably going to feel better and probably going to last longer. It's a very simple concept. And when we treat people with manipulation that have low-grade disc disease and we make them work better, they don't need the next treatment. They're good at that level. Most of the time, people skip this. They go from nothing to maybe some medicine. They'll go straight to injections. They'll have injections. Injections can be very, very effective. Many of our patients have injections. But injections don't address the function of the spine. They don't address that stiffness that we talked about, the asymmetry and the stiffness, and thus the injections wear off, and when they wear off, the person is back into pain. Well, the other thing is the disc naturally ages, and when there's more pressure on the disc, it ages more quickly, and that's what we're trying to avoid. We want your body to feel its best because it's working well. If you need injections because your disc disease is at a higher level, that's fantastic. We send people for injections. We believe in that, if you will, but only if these other levels of care haven't been successful, okay? So after manipulation, we usually do an MRI if you haven't already had one. If the MRI shows disc disease, we move to decompression. What you have to understand about the spine is the discs are very what we call hydrophilic. That means they love water. When you take pressure off of your disc, they soak up water, they imbibe fluid, and they can basically kind of repair, if you will. They can heal. The discs are not vascular. They have no blood supply. So when we lay down at night and we have a healthy spine, our discs soak up water, they recharge for the next day. When a healthy person, when you wake up in the morning, you're actually a little bit taller than when you go to bed at night. And this process happens every single day, and you don't realize it's happening until it stops happening. When it stops happening, your spine can begin to hurt, and we call that discogenic pain. And if that's bad enough, we do this process called spinal decompression. It pulls pressure off the disc. It basically helps water soak into the disc when the pressure's off. When you get off the machine and weight bear again, the water does flush back out, but that creates a rinsing or flushing effect. And it's very similar to taking a sponge, dripping water through it, but stimulating the sponge by squeezing it. You will basically rinse the sponge faster by mechanically stimulating it than if you just let water drip through it. And that's what decompression does. It stretches you axially to restore your axial flexibility so that you can basically upregulate the healing process. Very, very good treatment, wonderful treatment. And the fact is, most people get better with the combination of mechanical treatment, decompression, and injections, but there are some people that need surgery. In fact, there are certain indications that we use to determine if a person needs surgery. That is progressive neurological deficit. That means that you have a nerve that's being pinched, and if you did not unpinch it very quickly, you might lose that nerve forever. That's basically the consequence, and so we do surgery for that. And then also, if you have unrelenting pain that has not responded to anything else, that would be another indication for surgery. So some people do need surgery, but in my opinion, they need to have exhausted the other previous treatments that are less invasive than surgery, and we call that an ascension model of treatment. We ascend to the next treatment if the previous treatment did not work. So in this section, I'd like to talk about premature aging of your disc. I would say that people who live with long-term, low-grade chronic back pain, that you're in an accelerated aging process of your disc. And the fact is, we as humans, we can't get away from this aging process, but we can speed it up or we can slow it down. And there's a lot of different analogies we can give for that. The skin is a pretty good analogy. If we take care of our skin in our 20s and we put sunscreen on and we do moisturizer, those types of things, when we're in our 40s and 50s, we look younger. If we ignore our skin in our 20s, in our 40s and 50s or 60s, we look older. And the fact is, you can't adopt a skin regimen later in life to make up for what you didn't do early in life. And the spine is very similar. If you live with a kind of chronic spinal pain, low grade, that type of thing over a long period of time, it's a little bit like driving your car slightly out of alignment. You can do it when the tires are brand new, but over time, those tires are going to wear down faster than they would have otherwise. You cannot stop all tire wear, that's not the point, but you don't want to upregulate that wear and tear of the tires by being out of alignment. And our spines work similarly. If our spine does not work properly, if we don't have proper flexibility, the proper symmetry, posture, strength, and then youth being the one we can't control, if those factors aren't present, we are upregulating or accelerating the aging of our spine. And that goes back to that simple concept that we work under, which is if your spine works better, it feels better, and it probably lasts longer. So premature aging of your spine is going to be upregulated, I would say, when you have a low-grade, chronic pain that you've been experiencing for many years that doesn't seem like a big deal. Certainly we see people who have severe exacerbations of that pain that drives them into the clinic, but upon questioning, they've had back pain for a very long period of time. And I would say that take care of things earlier rather than later. They're certainly more simple to take care of before you have a big event, like a disc herniation or a pinched nerve or something like that. And that's a very important concept for you to know. So with that in summary, I just want to make the point that when we have a framework that we can plug people into and we can determine where your posture has gone wrong, where you're stiff, how that stiffness is different from one side to the next, and if we improve upon those, that's how we have helped literally thousands and thousands of patients over now 25 years of practice. And I'm very proud of our reviews. It's the way that we've obtained the reviews that we have as well. And it's because we're not just seeing people just to see them, we're seeing them and determining where they fit into this framework and we're giving them homework to do, or I'm doing things to them that help to get these back to the best they can be, except for the age. I wish we could back age up, but we can't do that. But we can certainly make your spine work better. And if you need professional help of any type, then we're here. You certainly can opt in using our automatic schedule on the website. We also have videos on our website that potentially would help you with different aspects of homework to do. And if you don't live in our area, then certainly take a look at those. And with that, I want to thank you for watching this video and hope you learned something. And do reach out to us if you have any questions whatsoever. We're here to help. Thank you.